may I take the opportunity to invite Dr. Padma Garu to say a few words.
Good morning, all. Thank you for sacrificing your Sunday morning sleep and coming here. At the outset, I'd like to thank K.S. Murthy Garu for this very elegantly organized meet. And I thank him for also felicitating so many doctors, probably 1,000, as he just was mentioning. And COVID times have been very difficult times for everybody, not just the common man, but for even doctors too. Like he said, and Dr. Suresh Garu also was mentioning, it was a war without any ammunition. None of us really know in the beginning that it was going to be so prolonged and protracted, and none of us knew really any protocols or nothing. We just went with a very open mind, and we were just treating it as just a viral infection, and we didn't know the long-term complications. Protocols, there were no protocols, no guidelines, nothing. So it was really very challenging, and we also had to deal not just with the physical ailment, but it's also, we had to deal with a lot of patient anxiety, a lot of anxiety, a lot of anger from the patient families, an isolated patient, we remember taking calls even at night, 3 o'clock, patients wanted to come out of the isolation. They were threatening us with all kinds of calls. So people who have actually managed the cases actively, we had seen all of it. So, frankly speaking, I am not aware of any single doctor who's not felt overwhelmed in those times. So we all had our own ups and downs too. And this was one phase that we would never probably forget in our lifetimes, where we were learning actively each moment, and still there was so much of hesitancy to do things, and it was a lot of frustrating moments also. So it's a really great thing to honor people who have gone through all these things and recognize their efforts. And I urge Dr. Murthy Garu, since he's in the media side also, he should probably take this across to media and ask them to be a little friendly to the medical fraternity in general, because many times, we've seen in the media very bad reports or very overrated stuff too in those times. And while the real doctors were actually treating the patients, we had seen many doctors who were coming on media and probably, they were just talking a lot of stuff which was also not making sense. Many were giving out some good details, but most of them were also propagating a lot of fear and anxiety too. So I think there needs to be a fine restraint on the media, and also the doctors who are getting onto the media as well. It's a great privilege and honor for all the awardees to take away this award with Dr. Kalamji's name on it. That's the cake and the icing too, I feel. Because who doesn't know about late Dr. Abdul Kalamji? He's India's most celebrated scientist. He's the missile man and the people's president. And he taught us mainly to dream, and he taught us what good dreams are, how to realize our dreams, and how not to be affected by failures. And he, more importantly, his greatest contribution, I feel, is he's spoken to hundreds and lakhs of young minds in this country and motivated them to do better. And that's his biggest contribution, I feel, apart from to the science and technology. And all of us know his contributions to the medical field as well. So I take this opportunity to thank each and everybody here on the dais, Dr. Dayalji, Dr. Pradeepji, Dr. Harikumarji, Dr. Suresh Garu, and Dr. Vijay Reddy Garu, and more importantly, the man behind this great, elegant show, Murthy Garu. Thank you very much.
Everyone asks us to wear mask and this.
ఇలాంటి ఒక వెరీ ఎలిగెంట్లీ కండక్టెడ్ ప్రోగ్రామ్ ఈజ్ మచ్ నీడెడ్. ఇట్స్ యాక్చువల్లీ ఎ ప్యాట్ ఆన్ ద బ్యాక్ ఆఫ్ ద డాక్టర్స్ యాక్చువల్గా. అంటే ఏంటంటే కోవిడ్ టైంలో ఎంతోమంది అంటే ఏమీ ఆశించలేదు, ఏదో అవార్డ్స్ కోసమో దానికోసమో లేకపోతే ఎవరో పొగడాలని కాదు, డాక్టర్స్ బాధ్యతగా ఎప్పుడు వాళ్ళు జాబ్ చేస్తారు. బట్ ఇలాంటి ఒక ఆర్గనైజేషన్ మేము రికగ్నైజ్ చేశాము, మీ అవార్డ్స్, మీరు ఆ టైంలో పడ్డ ఇబ్బందులు అవన్నీ మేము వి ఆల్ అప్రిషియేట్ యువర్ ఎఫర్ట్స్ అనేది ఒకటి చేయటం అనేది చాలా మంచిగా అనిపించింది.
థర్డ్ వేవ్ రాకుండా ఉండాలంటే ప్రజలు ఎటువంటి జాగ్రత్తలు తీసుకోవాలని ఏం చెప్తారు మేడం?
ఈ జాగ్రత్తలు కొత్తగా మారేదేమీ లేదండి. ఫస్ట్ వేవ్లోనూ చెప్పాము, సెకండ్ వేవ్లోనూ చెప్పాము, ఇప్పుడు థర్డ్ వేవ్లో కూడా అదే చెప్తున్నాము. సోషల్ డిస్టెన్సింగ్ ఈజ్ ఇంపార్టెంట్, మాస్క్ పెట్టుకోవటం ఇంపార్టెంట్, హ్యాండ్ హైజీన్, అట్లాగే కాఫ్ ఎటికెట్ అంటే దగ్గు వచ్చినప్పుడు చెయ్యి అడ్డు పెట్టుకోవటం, ఒకవేళ ఏమీ లేకపోతే మాస్క్ అనేది కంపల్సరీ. అట్లాగే సిక్ పీపుల్కి కొంచెం దూరంగా ఉండటము, ఎవరైనా బాధ్యతగా ఒకవేళ దగ్గు కానీ జ్వరం కానీ ఏదైనా వచ్చినప్పుడు వాళ్ళే తమ బాధ్యతగా మిగతా వాళ్ళతో కొంచెం దూరం మెయింటైన్ చేయటం, ఇవన్నీ ఇంపార్టెంట్. అన్నిటికన్నా ఇంపార్టెంట్ ఏంటంటే ఏదైనా ప్రాబ్లం అనిపించినప్పుడు వాళ్ళు ఇళ్లల్లో వెయిట్ చేయకుండా వాళ్ళకి తెలిసిన డాక్టర్స్ని కన్సల్ట్ చేసి ఈజ్ ఇట్ సంథింగ్ టు బీ టేకింగ్ కేర్ ఫర్దర్, అంటే ఏమైనా టెస్ట్ చేయించుకోవాలా, ఏమైనా వాళ్ళని వెళ్ళి కలవాలా అనేది చూసుకోవాలి అందరూ.